Gonorrhea is a common sexually transmitted infection, STI, caused by the bacterium Neisseria gonorrhoeae. Sometimes referred to as the clap or the drip, gonorrhea primarily affects the mucous membranes of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the urethra in both men and women. It can also infect the mouth, throat, eyes, and rectum. Gonorrhea is a significant global public health concern due to its prevalence, potential complications, and growing antibiotic resistance. Causes and transmission. Gonorrhea is caused by the Neisseria gonorrhoeae bacterium, which thrives in warm, moist areas of the body. It is transmitted through unprotected sexual contact, including vaginal, anal, and oral sex, with an infected partner. The bacteria can also be spread from an infected mother to her baby during childbirth, leading to serious complications such as blindness in the newborn. Gonorrhea spreads easily and can be transmitted even if the infected person shows no symptoms. It is particularly common among young people aged 15 to 24 years, due to higher rates of risky sexual behavior and limited access to sexual health education and services. Symptoms of gonorrhea. Symptoms of gonorrhea can vary depending on the site of infection and the sex of the person infected. In many cases, especially in women, gonorrhea may be asymptomatic, making it difficult to detect and treat early. In men, painful or burning sensation during urination. White, yellow, or green discharge from the penis. Swollen or painful testicles, less common. Infections in the rectum may cause discharge, anal itching, soreness, bleeding, or painful bowel movements. In women, increased vaginal discharge, painful urination, vaginal bleeding between periods, abdominal or pelvic pain, pain during intercourse. Rectal infections may present with symptoms similar to those in men. Because symptoms in women are often mild or mistaken for other conditions like urinary tract infections, UTIs, or yeast infections, many women may not know they are infected. Complications. If left untreated, gonorrhea can lead to serious and sometimes permanent health problems in both men and women. In women, pelvic inflammatory disease, PID. This is a serious infection of the female reproductive organs that can cause chronic pelvic pain, infertility, or ectopic pregnancy. Infertility. Gonorrhea can damage the fallopian tubes and uterus, leading to infertility. In men, epididymitis, a painful condition of the testicles that may lead to infertility if not treated. Prostate infection, inflammation of the prostate gland. In both sexes, disseminated gonococcal infection, DGI. If the bacteria spread to the bloodstream or joints, it can lead to DGI, which can be life-threatening. Symptoms include fever, joint pain, skin rashes, and swelling. Increased risk of HIV. Gonorrhea infection can make individuals more susceptible to acquiring or transmitting HIV. Diagnosis. Gonorrhea is typically diagnosed through laboratory tests. These may include urine tests, common for diagnosing urethral infections. Swab tests, samples taken from the cervix, rectum, throat, or eyes can be tested for the presence of the bacteria. NAAT, nucleic acid amplification test. This is the most accurate and commonly used test to detect gonorrhea DNA in bodily fluids. Screening is particularly important for sexually active individuals, especially those with multiple partners or those who do not regularly use protection. Treatment. Gonorrhea is typically treated with antibiotics. However, antibiotic resistance is becoming an increasing concern. The Centers for Disease Control and Prevention, CDC, currently recommends ceftriaxone, a single intramuscular injection, as the first-line treatment. In some cases, oral doxycycline may be added if co-infection with Chlamydia trachomatis is suspected or confirmed. It's important for sexual partners to be treated simultaneously to prevent reinfection. Individuals are advised to abstain from sexual activity until 7 days after completing treatment and until all symptoms resolve. Prevention. Preventing gonorrhea involves a combination of strategies. Safe sex practices, consistent use of condoms or dental dams during all forms of sexual activity reduces the risk of transmission. Regular screening, routine STI testing is essential for sexually active individuals, especially those with new or multiple partners. Communication, open discussions with sexual partners about sexual health and STI testing. Avoiding risky sexual behaviors, reducing the number of sexual partners and avoiding sex with individuals known to have STIs. Public health and resistance concerns. The emergence of antibiotic-resistant strains of Neisseria gonorrhoeae is a major global health challenge. Strains resistant to ceftriaxone, the last reliable treatment option, have been identified. This has led to concerns over the potential development of untreatable gonorrhea. Research is ongoing into new treatments, vaccines, and public health strategies to combat the spread and resistance of the infection. Conclusion: gonorrhea is a preventable and treatable sexually transmitted infection, but it requires vigilance, early detection, and proper treatment to avoid serious health consequences. Increasing awareness, improving access to health care, promoting safe sex, and addressing antibiotic resistance are key to controlling the spread of gonorrhea globally.